talk about stroke and how it affects the visual system. Every year in this country, there are approximately 800,000 people who sustain a stroke. Of that amount, there's about 600,000 that sustain a new stroke. The stroke can have devastating effects on the patient. Depending on the location and the age of the patient, the severity of the stroke will have a determining factor. With vision, we worry about several areas. One is the fact that they may lose part of their visual field. The visual field defect is very common in about 50% of the patients who've had strokes. It may be a small visual field loss or a very significant field loss that involves half of the patient's visual field. When there's a visual field loss, it affects their mobility, their ability to read, coordinate their body, and movements are affected, and the general welfare of the patient is at risk. Over the age of 65, about 50% of the patients that sustain a stroke have mobility problems. Their visual spatial concerns after a stroke, the ability to judge space accurately, that is, judging space and depth perception, and knowing where the body is in space when moving is a big factor. I'm fortunate to have privileges at several hospitals, and the majority of the patients that I actually take care of are stroke patients. During the evaluation, I'm looking for problems with eye movements, problems with eye coordination, and problems with mobility. The visual system is very powerful and does affect all these areas. One of the other facts that we need to understand is that when there is a visual field loss, it affects the way the patients are able to read and comprehend information. An area that is studied pretty significantly with the stroke patients is called visual spatial inattention. This is where individual who's had a stroke may not perceive the space off to one side. Usually it's the left side that's involved. And therefore, when they're eating or when they're doing activities that involve the left side, oftentimes they don't perceive that space at all. It can be so severe that they don't even perceive that they have a left arm or that they have a left side to their face. When they're eating, sometimes they'll eat all the food on the right side of the plate and leave all the food on the left side, not knowing that it's there. This visual spatial inattention is something that is amenable to therapy. In our practice, we have special tests that we run that will significantly identify these patients. The therapy that we do is to teach them to scan into the fields where they're having difficulty. If it's the left side of the field, we'll place objects into the left field and encourage them to move and to locate those objects. Over time, this has the ability to break down the visual spatial inattention. Another area that we look at in our evaluations is binocular coordination. That's how do the two eyes work together as a team. After a stroke, oftentimes there's problems with this area, such that they may be reading and noticing that the print is doubling up, or when they're looking at distance and watching television, they're seeing that the images are splitting into two. And this is very disconcerting, as you might imagine. We can rehabilitate patients who do have double vision through doing vision rehabilitation. There are many techniques involved here, but we need to get the motor system activated. The motor system involves both sides of the body working together. Eyes are part of the brain and part of the body. So if we move the body in specific patterns of movement, we can actually encourage the visual system to work at a higher level. If you'd like more information about how to help your patients or help your family members who've had a stroke, please feel free to call our office. I personally will take that phone call. Thank you.